Welcome to my podcast. I'm going to talk about another important condition that we face in life. So basically, you have to introduce yourself to the patient and double check the patient name and date of birth. So the patient might tell you, doctor, I'm having sore throat, or I'm having sore tongue, sore mouth, I'm having bad breath, all sorts of things related to the oral cavity basically and the mouth. So you'll ask the patient, can you tell me more about it? Then you will ask the patient, do you have any thought? What might be the reason for that? So the patient might say, I'm oral breather, I'm having blockage in my nose, I'm having a long-term condition, for instance. So you will ask around the area. So you'll ask the patient, how do you take care of your oral hygiene? And do you regularly wash and clean your teeth, brush them and floss them? Have you ever had any bleeding when you brush your teeth or from the gum? What's the gum condition? Do you have any loose teeth at all? Any injury around? Do you eat hot, spicy food? Do you smoke? Because smoking is very related basically to gum, and also vaping. People nowadays think vaping is free from nicotine, but evidence shown it's the other way around. So vaping basically causes a lot of bacteria flourish in the mouth and can be associated with a lot of things like tooth decay, cavity, gum disease, and all of that will cause bad breath and will cause bad smell for the mouth and will affect of course, the gum hygiene and its healthiness. So also you will ask if the patient had any artificial teeth or if they have any bridge, for instance, especially in old age. So how do they take care of their denture? Does it fit well? Does it cause any irritation, any soreness, any ulceration? Sometimes they are really hard. They might cause local problem. So all of that you need to check. You might ask the patient to show you how they take it off and return it back. And always emphasize about the daily routine. As I mentioned, brush your teeth twice a day, morning and afternoon. Floss them daily to remove any dental plaque. And always visit your dentist if you think there is any issue, or maybe you can visit for a checkup 6 monthly. And always avoid anything has to do with smoking or tobacco, generally speaking. So this is one thing. Also, you'll ask the sort of food they eat and if they clean after that. And as I mentioned, how they breathe, because basically mouth breathing will cause dryness for the mouth, and this might flourish also candida. So all of that should be put in consideration. And also you need to never to ask the patient what their total idea, as I mentioned, and if they have any medical condition that he's taking for it, a medication for a long run, and also any medication that he's taking, allergy, of course, as I mentioned before. And then you will ask the patient, I would like to have a look. So you will ask for the patient to open their mouth, get your torch, have a quick look. Healthy gum, usually it's pinkish, it's lustery, but if it's dusky or vivid color or swollen, all of that emphasize unhealthy gum. And sometimes there is like a pocket around the root of the teeth, which could harbor a lot of things, and this cause, of course, bad hygiene for the mouth and bad smell, which can be frustrating for the patient and the surrounding. Also, you can tell the patient there is a very cheap antiseptic you can apply, which is salt gargling, which is very good and healthy as well. And tell the patient anything that irritate usually the gum should be avoided. And Also, you need to agree with the patient with the management plan. As I mentioned before, after you just examine the patient and have a quick look, you will tell the patient here what we think might be the issue. If it's gingivitis, for instance, or a periodontal disease that could cause constant irritation or redness or swelling. So you need to emphasize that they need to stop, for instance, the things that they are doing. They need to visit of course, their dentist, because unhealthy gum which could cause a lot of problem in the future. The teeth will be unstable, will be fallen, and as I mentioned, unhealthy gum always will look dusky, dark, have a bleeding. They could be swollen. Also, they might be residing from the teeth themselves. They could be tender beside the bad breath, and all of that could be, of course, as I mentioned, due to a lot of things, mainly smoking, which could cause plaque, which turns into tartar, and of course the inflammation, which could infection and inflammation, and this will cause a long run, gingivitis, which could lead, as I mentioned, eventual tooth loss. And basically, you need to ask, as I mentioned, about any risk factor. For instance, if they have not looking after their mouth, which is basically bad oral hygiene, smoking or chewing tobacco. You find a lot of people sometimes they chew tobacco in certain culture. As I say, mouth breather, if they have also deficiency in vitamin C, and certain old age, and certain condition, of course. We know that there's certain medication which could trigger gum hypertrophy, like, for instance, phenytoin, calcium channel blocker, angina medication, which is used for, and in certain, of course, condition, hormonal changes. Or it could be something could be related to genes, genetic. So always, as I mentioned, emphasize and promote good health practice. Avoid sugar eating, and if you eat it, you need to wash your mouth immediately. If the patient is diabetic, he need to be doing periodic checkup in order to make sure that their blood sugar within the normal level, or as should be expected, controlled. Visit their dentist, and always, as I mentioned, wash and floss your teeth. So all of that could cover anything related to the teeth problem. And also not to forget about certain antibiotic as well. If the patient, for instance, has a deep infection, or the tooth has been removed, or any of that, you need to check with your dentist what might suggest for you to take. And also, as another thing can be done, if you don't like the salt gargle, you can have mouthwash from the dentist, from the pharmacist, or from OTC shops, which can be used as well to improve and keep the mouth clean and hygienic, in order to avoid any condition could cause issue in the future for your teeth. So by that, I hope that I covered most of the things related to the tooth and around them. And please keep taking care of your mouth and your oral cavity, because this is your part of your body which could reflect a lot of things inside your body. Thank you.